Britain's tax system is mathematically broken. Correcting its specific flaws would generate hundreds of millions of pounds for the government. Removing these financial traps would allow a massive reserve of suppressed labor to return to the workforce. Highly skilled professionals would start working more hours. This shift would also remove an invisible barrier preventing these same workers from having children, potentially reversing a national birth rate that just hit a record low of 1.41. But fixing this math problem is politically toxic. To restore that labor supply and boost the birth rate, the government would have to hand billions of pounds in childcare subsidies and tax relief directly to the top 4% of earners. They would be doing this while keeping a strict cap on basic welfare payments for the poorest families in the country. It places policymakers in a situation where raw economic survival requires a direct retreat from fundamental social fairness. To see the mechanics of this trap, we need to look at a demographic known as Henrys, high earners, not rich yet. Think of a senior doctor in the National Health Service making roughly £100,000 a year. By national standards, that is a distinctly high income. Yet, after paying London-weighted living costs, taxes, and student loans, many of these professionals are essentially living paycheck to paycheck. They have become genuinely afraid of receiving a promotion. We will first examine the invisible architectural trap that punishes their ambition. Then we will look at how this engineers a demographic crisis. Finally, we will weigh the impossible ethical paradox required to solve it. A six-figure salary in the UK is no longer a marker of wealth. It is the trigger for a punishing financial trap. This chart maps gross income against actual take-home pay. The first trap triggers precisely at £100,000. For every £2 a worker earns above this line, the government strips away £1 of their tax-free personal allowance. Combine that with the 40% income tax bracket and national insurance, and workers face a 62% marginal tax rate. While the taper is a slow drain, the system also contains hard cliff edges. If a working parent's income exceeds £100,000 by a single pound, they instantly lose their entitlement to 30 hours of funded childcare and tax-free childcare subsidies. For a family with 2 young children in London, that results in an overnight loss of up to £22,000. Because of this overlap, a parent earning £99,000 who accepts a £1,000 raise can lose over £15,000 in total income. That creates an effective tax rate of over 1,600% on that additional £1,000. These rules assess individual income rather than household income. A dual-earner family where each partner makes £59,000, totaling $118,000, keeps their full child benefit. But a household relying on a single earner making $80,000 loses every penny of it. The UK tax code functions as an uncoordinated wall of penalties that actively punishes career progression and productivity. When this threshold was designed in 2010, it caught fewer than 600,000 people, but the £100,000 line has never been adjusted for inflation. Today, that salary holds the purchasing power of roughly £61,000 in 2010 terms, dragging nearly 2 million taxpayers into the trap. This flat national threshold ignores regional geography. A £100,000 salary in the Northeast provides a high standard of living, but in London, average house prices are over 3 times higher, and inner-city nursery care can cost £30,000 a year. After covering their housing and childcare, a top earner in the capital can be left with virtually zero disposable income. Professionals have begun rationally suppressing their own taxable income. They dump excess earnings into pensions, refuse career promotions, or drop to 4-day work weeks to ensure they stay safely at £99,999. This income suppression hits public services directly. The British Medical Association reports that senior doctors are refusing extra life-saving shifts specifically to stay below these tax thresholds, directly limiting the NHS's capacity to treat patients. The ultimate casualty is the birth rate. Highly educated women consistently report wanting an average of 2.2 children, but they are having only 1.4. For these families, accepting a raise and losing childcare subsidies is so financially irrational that it acts as a barrier to having another child. Earning more has become so counterproductive that the country's most capable workers are actively restricting their economic output and the size of their families. Economic modeling proves that removing these caps would generate up to £425 million for the Treasury. High earners would immediately have a financial incentive to work more hours, broadening the taxable income base. But removing the penalties means funneling billions of pounds in state resources directly to the top 4%. These affluent families would gain vast surplus capital to invest in private school fees and premium housing, entrenching their advantages and widening the wealth gap. The political roadblock is the two-child limit on universal credit. This policy legally denies basic subsistence money to the third children of the absolute poorest families in the country. The state is paralyzed by the optics. Policymakers cannot easily justify subsidizing the rich to have more children while enforcing a strict cap on the destitute. There is no deliberate villain in this story. The UK is simply trapped by an accretion of disconnected, poorly designed policies that have backed the country into a corner. Policymakers must now choose between the cold macroeconomic efficiency required to secure the country's birth rate and the principles of fundamental social justice. Within Britain's current tax architecture, it is mathematically and politically impossible to have both.